Hello, everyone. I'm Brian Bergstein, the Boston Globe's Deputy Opinion Editor, and welcome to this Globe Op Talk on using technology to track COVID-19 with Albert Foxconn. Globe Op Talks is a new series of conversations that we've launched in which members of the Boston Globe editorial board interview the unique voices who write for the Globe Ideas and Globe Opinion sections. So I'd like to welcome our guest, Albert Foxconn, who is founder and executive director of the Surveillance Technology Oversight Project, also known as STOP. And he's a fellow at the Engelberg Center on Innovation, Law, and Policy at NYU. So Albert recently wrote an op-ed in the Globe with Evan Selinger, professor of philosophy, at the Rochester Institute of Technology. And it was headlined, "Tracking Coronavirus with Smartphones Isn't Just a Tech Problem." The subtitle was, "Protecting Our Privacy and Civil Liberties Requires More Assurances Than Silicon Valley Can Provide." So we'll get into why that is, why Albert and Evan feel so strongly about that. But first, Albert, welcome. Thank you for being here. And before we get into why you and Evan made that argument and the broader question of just how appropriate it is to use technology to track our whereabouts in the pandemic, first, tell everybody what it is you do, how you got into this line of work. What is the Surveillance Technology Oversight Project?
Well, Brian, thank you so much for having me. It's really a pleasure to join you. I founded STOP a little over a year ago as an organization committed to fighting the growth of warrantless surveillance at the state and local level. We've had this fight over government surveillance in Washington for my entire adult life, longer than that. But we really hadn't seen the sort of pushback we thought was appropriate here in New York at the state and local level and in localities all around the country. And so as my training is as a lawyer, I was at a large firm for a number of years representing technology companies. And now I'm trying to hold them and the government agencies that partner with them accountable for technologies that are discriminatory, invasive, or just completely unconstitutional. And so we do that through a mix of litigation, legislation, public advocacy, grassroots education, and engaging with the media to help educate the public about the issues we see on the ground.
So when you were a lawyer working for technology companies, did you see things going on that you realized the public was, in your mind, insufficiently aware of?
Yeah, I feel like a lot of us who have been working in this space have kind of been saying the room was on fire for a long time. We've seen these things that really had us quite concerned. And for me, it goes back even before law school, before Snowden. This is something that I've been passionate about my entire life. And so it's, we keep seeing disclosures that make us realize that those concerns were justified. And now, rather than it being an outlier opinion that surveillance is really challenging the fabric of democracy, it's something that's an everyday discussion topic.
Okay, so that's the backdrop here, that you have concerns about the way that our devices and networks are already this platform for surveillance, whether it's surveillance by the government indirectly, companies that want to sell things to us, right? Just broadly speaking, we've enabled this this platform of that has uses beyond maybe what we're all thinking about as we go about our days. Does that sound?
Yeah, and how it reinforces a lot of the inequities that we've seen through generations of policing, where communities of color, undocumented communities, are bearing the brunt of that surveillance. And we can talk about some of the specifics there, but we definitely view this as a racial justice issue and an immigrant rights issue as well.
Okay, I do want to get into all that, but before we go down into the details of that. So with that as the backdrop, how you see the network technology that we're all swimming through in our daily lives, what did you think when you started to hear about possible ways that technology could be used in the U.S. To have an epidemiological purpose, to track people's whereabouts, to figure out where hotspots of the disease are, How did that layer onto the thinking that you already have, and how you see these systems, and especially the way that other countries like China and Singapore have used wireless technologies for exactly this purpose, in public health?
Well, surprisingly, my first reaction was actually one of hope, because there was a part of me that really was hopeful that these tools would give us a way to push back against the spread of COVID-19. I'm a New Yorker. I've seen just so many communities decimated by this pandemic. And, even in those early stages, like, we were quite concerned about the impact it would have here in the US. But the more I looked into the technology, the more alarm bells I saw, both because of the dangers of how this technology could be misused, but also the lack of evidence that it actually was effective in combating the spread of COVID-19. Some of the earliest examples we saw came out of China, where you had the use of cell phone location information, both CSLI, cell site location information, and GPS data from cell phones to monitor when people were leaving Wuhan and Hubei province to see whether they were breaking quarantine. But then you started to see other forms of technologies, new forms of apps that would monitor your location. We saw Russia rolling out facial recognition. And we started to see a lot of countries using COVID-19 as a pretext to roll out surveillance tools that seem to be more focused on fighting, political opponents than fighting the spread of the disease.
What's an example of that?
Well, I would say the facial recognition system in Russia is one of the most blatant examples, because a lot of COVID-19 exchange will happen in private spaces where you're not going to be able to monitor if someone was in 6 feet of someone using a facial recognition camera from outside of the building. What you can do is monitor if people are going to, protest, if they're going to religious institutions. You can monitor those sorts of routines. And so it really seemed like a technology that was poorly suited for monitoring the sort of persistent close contact that's needed for COVID-19 to be transmitted. Also, in the case of China, we saw the proliferation of these apps that would give people a color code. If you got green, you were free to travel, but if you got a yellow or a red, then you had to quarantine at home. And this meant that people were being denied access to education, to the chance to work, to, travel around the country. But, researchers quickly found that these applications had, a code that would enable the data to be shared with police, not just public health authorities. And we also started to hear reports of individuals who didn't have any of the risk factors for COVID-19, who couldn't understand why they had been flagged as a potential threat, but they were still getting that yellow or red code, which of course raises the possibility that, government officials were manipulating those codes to, make it harder for people to take part in public life, not because of their public health threat, but because of their political threat.
Okay, so what if someone here were to say, okay, that is a cautionary tale, the way it was applied in China. We can learn from that. We can put in safeguards against the worst of those abuses. We could silo the data, make it explicit that police can't use it, and so on, right? Why would you be skeptical of the argument that it would be possible to design such a system here that respects the Fourth Amendment and is much more sort of limited in scope?
There may be a way to have a perfect system that does that, but none of the systems I've seen yet have those sorts of safeguards, have those sorts of legal protections. There's no federal law that would prevent ICE from using the data we collect to fight COVID-19 today to deport our neighbors tomorrow. But more importantly, taking a step back, until we have widespread access to quick, reliable testing, a lot of these technological responses are a distraction at best. If I get a notification on my phone that says you have been within 6 feet of someone who tested positive for COVID-19, there's literally nothing I can do in response to that. I have to do what I've been doing every day for months now, which is assuming there's a risk that I've been exposed and limiting my, interaction with others just to prevent possible transmission. I think it's a question, until we have the resources to actually follow up on any potential tracking data, to me, it seems like these tools are really a non-starter.
Okay, so to make sure everybody's on board with what we're talking about, this idea of using Bluetooth to track who you've been in touch with and later warn you. Why don't this goes to the heart of the op-ed that you and Evan Selinger wrote, which is that there's a appealing sounding technological approach here, but it's not something that technology alone can solve. So why don't we make sure everyone's on board with the premise of the system as envisioned by Apple and Google. So there might be many ways that wireless technologies could be used, but why don't you just explain what it is about the Apple and Google proposal in particular, and how it's proposed to work?
Yeah, so the Apple-Google model builds on work we've seen in Singapore and work by a variety of researchers here in the US. And the key difference is it's decentralized. So when we were talking about use of cell site location information or GPS data, that's centralized. That's data that the government's getting from cell phone carriers, from the cell towers, from software manufacturers. But with the Apple-Google model, it's decentralized. So each of our phones has access to Bluetooth transceivers. So these are little radio antennas that use, short range, high frequency transmissions to talk to nearby machines. Usually we experience it through Bluetooth headphones, or it can be a short range data transmission. But what this system does is it'll set up our Bluetooth antennas on our phones, possibly other devices, to sort of constantly be saying hello to every device in the area. So it's just constantly pinging, and it's constantly listening for other devices that are pinging. And if two devices are near each other for, let's say more than 30 seconds within 6 feet of each other, then they'll record the fact that they were close to each other. And what makes this model different is they aren't actually exchanging phone numbers. They aren't saying, hey, my phone's owner is XYZ. Instead, they're coming up with a unique encrypted code. And that code is all that identifies the fact that the two phones were in proximity. This means that if you get a COVID-19 test, 3 days later, 10 days later, your phone can post a list of all the codes of all the interactions you've had over the last 2 weeks. And then my phone can go and look up that code and say, oh, okay, this is someone who I was within 6 feet of 3 days ago, and tell me that I should get tested. And so when you're talking about that type of scenario, where it's just two phones passing each other on the street, or maybe you and your neighbor are saying hi in the hallway, that use is pretty secure. But the way that this system is being developed, even though it's decentralized, because Bluetooth is transmitted in the open, because these radio waves can be intercepted by anyone standing nearby, and because it's quite easy to deploy a lot of these antennas, it actually becomes easy for corporations, advertisers, and government agencies to turn this into a type of tracking tool.
So that's why you and Evan wrote in the op-ed that making this work appropriately is sort of beyond the range of what Apple and Google could bake into the system, that it would require all these like outside civic and political and legal safeguards. Is that?
Yeah, I mean, part of it is the technical limitations of encryption, but part of it's just the legal limitations here of saying that this is, quote, opt-in. So Apple and Google talk about how you need to opt in to having this on your phone. And yeah, you'll have to, click a little box, you'll have to read the terms of service, and you'll have to agree. But the problem is that there aren't the legal protections we need to make sure that you're actually consenting to that, and you're not consenting to that because it's required by your employer, or it's required to go to a public park, or required to pick up your kids from school. We could easily see, companies and government agencies making this the price of engaging in public life. And suddenly that whole promise that this is opt-in, that's voluntary, will become an illusion. And we think that that sort of burden will fall most harshly on, lower income communities, where people may not have the resources to say, no, I'm not willing to be tracked as a condition of this job. No, I don't, they may not have the capacity to make a meaningful choice in that moment.
Right. So the extent to which this is not truly voluntary, even if it's couched in the language of consent, it sounds like that is something that's really resonated with readers who have sent in questions in advance, and some of the feedback we got on your original op-ed. I mean, that's a pretty powerful argument that it's not, no matter how it's set up, it could never really truly be voluntary in that truest, freest sense of that. But what about, there is a line of thinking that I've also heard, and some readers have written in to say, well, what if this were, even with the caveat you just raised about it not being voluntary, what if it were temporary, just an experiment in certain cities? What if the safeguards were written into law that this could not be used for advertising, for policing, for immigration enforcement, and so on? You could devise the sort of perfect realm of legal protections. What would be the hesitation there if it was possible that a system like this could allow some return to normal life?
Well, I think if we're talking about a system that, first of all, works, that actually helps track and combat the spread of COVID-19, that has those privacy protections, that may be something that's worthwhile to invest in. The problem is that bears no resemblance to the reality we see on the ground. It would take an act of Congress to prevent this information from being misused by immigration authorities in the future. It wouldn't be enough to simply have a municipal ordinance or a state law. It would really take something equivalent to what we see with Title 13 with the US Census, where the US Census gathers highly invasive information about all of us every 10 years. But we have legal protections, on the statute books that prevent it from being misused for other purposes. But short of that act of Congress, short of those additional restrictions, probably under state law as well, we wouldn't have that guarantee that it's going to be kept private. But even if we had those protections, that would, I think it would take a number of laws to address each and every one of these issues, and you'd still be left with the fact that the technology just hasn't been proven to work. And it's unclear how you could actually get the level of participation needed to make it work without that sort of coercion. Singapore had 12% usage, 12%. And it was, and people were very excited about it, except now they've seen an increase in COVID-19. And I've seen some reports that the rate of infection per capita there now is approximately the same as in the US. And so it's not enough to simply have this freely available and have it, so that 12, 15, 20% of the population can opt in. The only way it works is through coercion, because that's going to be what's necessary to get it up to 60, 70% buy-in.
I mean, I also worry a lot about the likelihood that a system like this would work. Just because our phones have registered that we were once in Bluetooth proximity for 15 minutes, if the system doesn't know whether we were both wearing masks, whether that was through a wall in our workplace, the meaning of that is tricky. Not to mention the fact, as many readers have pointed out in their questions, most people don't, well, not most, but a lot of people don't necessarily Bluetooth on all the time. It drains the battery. You would have to sort of do that. A lot of people's phones aren't of a new enough vintage to work with constant Bluetooth pings like this. So when we can see holes in how useful the information that the system would generate would be, and we can sort of question the idea that Bluetooth proximity is a good analog for contagion. I see how you come to the premise that it wouldn't be worth this extraordinary privacy incursion for something of dubious efficacy. So does that kind of get into how you think about this a little bit? Like if we
Oh yeah, completely. I mean, simply having your phone in your pocket can weaken the Bluetooth signal, because Bluetooth doesn't say, okay, I know that Brian was X feet away. It says his Bluetooth signal was this strong or this weak, and you judge, the weaker it gets, the further away you are. But simply having it in a phone case, having it in your pocket, having it next to another piece of electronics, that can distort the strength of the Bluetooth signal and give a false positive or a false negative. It doesn't know if I'm standing on the other side of a wall from my neighbor. That may make the Bluetooth signal weaker, but it could easily look like it was still within the 6 feet radius. And so I think that all of us are so desperate to find some way to solve this crisis that when technology companies come to us and say they have something that might work, of course we have that human impulse to respond, because no one wants to see a single preventable death. No one wants to see a single person in a hospital bed who doesn't have to be there. And if there's something we could do, of course we're eager to do it, but the technology just isn't there. Not using this sort of Bluetooth tracking, not using this sort of system. And I really do think that we're creating a lot of very immediate and concrete harms in exchange for promises of public health benefits that may never and likely will never materialize.
So last week, the government of France actually asked for Apple and Google to weaken some of the privacy protections of this system that the companies are developing. And basically, I mean, it's a stunning sort of moment, right? I mean, this is coming from France. European countries have traditionally been much more strict in their regulation of how data can be used and their privacy protections of privacy regulations on Silicon Valley companies. So here was the government of France saying, actually, Apple and Google, if you're going to do this, you need to weaken some of the privacy protections, because otherwise the system isn't usable for us, the government, public health authorities. They were asking that the system not be so decentralized. I'm just curious what you made of that. I mean, does that, if it's going to weaken the core protection of decentralization, does it point to the fallacy of the ability of a system like this to work at all?
Well, I mean, I think we're always, cautious about slippery slope arguments, but the truth is that Silicon Valley has a pretty weak track record on, actually respecting over the long term the privacy promises they make up front. And a lot of government agencies have even worse record when it comes to tools that can be turned into forms of mass surveillance. So I do think it's very worrisome that you're already seeing this debate play out, where you may have the API go live, you may have the software enabled on all of our phones, and then you may have it change. You may have it, shift into something that, captures more data than was promised. But I also think it's very strange that we're in a situation where these two companies are playing the sort of role that they are in the global pandemic response. They've said in the past that they will shut down the Bluetooth API once they determine that it's no longer needed in a given region, so that they'll be monitoring that, the level of COVID-19 infections, and they'll make that choice. And to me, it's very strange that we would have, private companies and not governments making that choice about whether this technology is needed. But I think the fact that they're so eager to turn it off once this emergency is over, it also points to the fact that there is a real risk to having it run in perpetuity. It isn't the sort of privacy panacea that we keep hearing.
Oh, did Apple and Google publicly respond to the French government's request?
I haven't seen their response. I also have heard, it needs to be confirmed, that there have been other government agencies that have reached out as well. And I expect that this is going to be an ongoing conversation, not a single moment in time. I think we're going to see a lot of requests for additional granularity, additional retention. Maybe they'll want to keep it past the 14-day window. Maybe they'll want to have more precision in the time code for when a interaction happened. And the truth is, these technology companies have the power to deploy those changes whenever they see fit.
So, to go back to the outset, to the concerns that you raised about location tracking embedded in a lot of our technologies, even before this, um, given the things that led you to form the Surveillance Technology Oversight Project, given what's just going on, the way advertising and advertisers can follow us around, couldn't someone argue, wait a minute, if I'm so concerned about my location privacy, why am I using a smartphone at all? And what's there might be some people who are willing to opt in for something like this under that same line of thinking, which is to say, look, I'm already tracked right and left by advertisers. I'm fine if the Massachusetts Department of Public Health asks me to download an app. What's the fundamental difference? So let me pinpoint the question there, which is, if I'm so worried about my location privacy, should I be using a smartphone anyway?
Well, I would say a couple different things. For me, as a lawyer, as a white guy, as an American citizen, it's quite easy for me to say, sure, I will take on that risk. But for my clients, for people I know who are being targeted but for their immigration status, who are being targeted by other governmental agencies, it's not an easy question to answer. And I think right now, when there's a real risk that a lot of people will be coerced into, using these tools as the price of, taking part in modern life, I think that's really troubling. But, the Supreme Court started to address this issue in 2018. There was a case called Carpenter v. United States, and Chief Justice Roberts, not the most progressive guy, not someone known for his liberal values, but even he said that we cannot, have this illusion that people are actually consenting to the level of tracking that their phones are capable of. That phones are indispensable to taking part in our communities, to taking part in society, and that when we treat that as a form of consent to governmental tracking, that we undermine the heart of the Fourth Amendment, and we create a type of omnipresent surveillance, a type of panopticon that really chills the most fundamental forms of First Amendment activity and political engagement and everything else that we want to protect when we put limitations on the power of the government to track any of us at any time for any reason.
So forgetting the specifics then of something like the Bluetooth tracing protocol that may or may not take hold here, do you think smartphones should play any role in contact tracing? I mean, other than, someone can call you on yours, the old-fashioned way. I mean, literally, would there be any way that you could see it being effective and done appropriately to use, whether it's cell tower data or anything like that?
I could imagine a situation where it would be hard to answer because you would have to balance, privacy against, efficacy. But I really think that the most effective contact tracing methodology we have, the only one that's actually supported by peer-reviewed research, the only one that's been shown to be capable of taking on a health challenge like COVID-19, is traditional human-based contact tracing. And I think, having a real investment in that, like Massachusetts has, like a few other states have, having, culturally competent, contact tracers who are going out into impacted communities, connecting with anyone who has COVID-19, reaching out to those who might be exposed, gaining their trust to help, reconstruct their, movements. I think that is the most effective model. I just don't think it gets the same sort of headlines that we see with Google and Apple because it's not new. It's not as cool. It's not as sexy, but it is effective.
Can it scale? I mean, if I test positive and someone calls me, a contact tracer calls me, and says, "Where have you been over the last week?" It's dependent on my memory. Um, contact tracing, do you think it can scale given the potential with this particular disease for asymptomatic transmission and, all the ways I'd have to remember where I am? I mean, do we think it can be done without the assist of location based technology?
I think that, it can it's not perfect, but I do think that the evidence we've seen so far shows that it is the most robust solution. And of course, it's different if people are reviewing their own data on their phones to refresh their memory as they're having that conversation with a contact tracer. But if you have government agencies seizing that data without consent, if you have them using these new applications with the illusion of consent to do it, you're going to drive a lot of people into the shadows. A lot of people aren't going to get tested, aren't going to get treated because they fear how that information is going to be used and abused. And we're quite concerned about, taking every measure we can to build trust with those who've been exposed to COVID-19, rather than taking, technology-centered approaches that will, destroy the trust that we already have.
So a lot of what we've been talking about today is theoretical, like the idea that there might be this app that we're asked to download to our phones that use the Bluetooth signaling to create this encrypted log of who we've been near. But as you pointed out to me, there was an interesting story in the Wall Street Journal about a month ago that didn't really get as much attention as it would have under any other circumstances. But it pointed out that the CDC and other agencies were already making use of aggregate location data to figure out how well social distancing procedures were taking hold or being followed. Can you talk a little bit more about what was going on there and whether we've seen anything like that before, and what you thought when you saw that?
I mean, to me, it was just outrageous because, as I mentioned, the Supreme Court said in 2018 that it was unconstitutional to have extended location tracking using cell phone data without a warrant. And here they were tracking the movement patterns of individuals in 500 cities. 500 cities, so probably millions of individuals having our social distancing patterns tracked without any judicial oversight. That information being shared with state and local authorities, potentially being shared with law enforcement. And to me, that sort of extreme invasion of personal privacy requires, at the very minimum, public oversight, judicial review, having these sorts of checks and balances. But here it was being done without an apology so much as asking for permission. And we actually today launched a 50-state open records effort where we at STOP and partners at law schools around the country are going to be submitting Freedom of Information Act or Freedom of Information Law requests to police, to public health agencies, to federal officials, trying to understand what surveillance tools they are deploying to monitor our social distance patterns and how they're protecting that information from being used for other purposes. And really, sorry.
Well, just to be clear, I mean, so again, the technology that was used in this case was exactly what advertisers are doing every day. You're saying it's a difference in kind, a difference of degree and a difference in kind when the government, even if it's the CDC, is the government agency, is doing it, right? Is that
exactly? Especially when the CDC is sharing that information potentially with law enforcement officials. Look, advertisers can be creepy, they can be invasive, but they can't arrest you. They can't deport you. They can't, use the awesome power of the government to target you the way that government agencies can when they have access to this location data. And in the middle of a crisis, we have to be even more cautious about how we're expanding the authority of government agencies and how what the lasting impact of that will be for civil rights and for our communities.
Just to be clear, also, just to make sure we don't inadvertently spread misconceptions, there was no evidence, though, that the CDC was sharing that with law enforcement you're saying, though, the potential is always there, that once a database is gathered, it could later be subpoenaed or used. Is that, just to be clear, right?
It was unnamed local and state partners. And part of what we're trying to understand is, were law enforcement agencies the partners who were getting that data? We don't know one way or the other, and which is why we're trying to find out what role, if any, for example, local police departments were playing in monitoring that data. Because here in New York, the NYPD has been principally responsible for monitoring social distancing patterns and enforcing restrictions. They've used drones, they've used closed circuit TV, they've used other tools. And so for us, when we see this sort of data being collected without any legal framework and without any protections, we get concerned.
So we only have about 10 minutes left. Unfortunately, I'd love to talk to you about this all day, but I think we should turn to some questions directly from the audience. And I want to invite Chris Avello, who's the Director of Subscriber Experience at the Globe, to join us. There's Chris. And he's going to share some of the questions he's selected from viewers.
Thank you, Brian. Thank you, Albert. And hi, everyone. Just want to take a brief moment to say thank you to all the Globe subscribers and readers who submitted questions and are joining us today. There's actually been so much interest in this topic and a real level of sophistication being demonstrated in the questions. So thank you guys so much. We couldn't do this without you. The first one I'll ask, let's assume something like the Google Apple plan is real. And Christine C. was asking, could you elaborate on how theoretically a corporation might get their hands on this information, whether individualized or aggregated, but how might that come to be?
Sure. So there are a number of different ways this could play out. For example, in malls and stores already, prior to the crisis, we saw companies using Bluetooth beacons to monitor, okay, where in the store are you located? What item are you stopping in front of? How long are you lingering there? In the context of COVID-19, you could see those same sort of Bluetooth beacons being put in a apartment building, for example. This would be a way for the landlord to monitor how many people in the building have COVID-19, but it could even monitor what floors they live on. It could even monitor, whether there are people violating the terms of their lease by having people visit who aren't on the lease, who then have COVID-19. So there are a variety of ways we could see it in a residential setting. And we could also see, municipal transit agencies, such as the MTA here in New York, using it to monitor how many people at a given station have been exposed to COVID-19. The problem is, once you have that sort of system where you have beacons at a specific location, you can easily then say, okay, I just got told that we were exposed at the following by the following handshake. You can then go through your own records, figure out exactly when that happened. You know where it happened because the Bluetooth beacon is in one place at all time. And with that time and location data, you can figure out the identity of the person who passed you by.
Got it.
But beyond the public health usage of this, which, a lot of people may say, hey, I'm fine with that. We're in this emergency. It sounds like your worry is also, though, that Bluetooth beacons everywhere would somehow be normalized and never really go away. I mean, is that also part of what concerns you here? Because I think there's going to be a lot of people in the audience today who are saying, everything you just described sounds fine to me, but elaborate on why you think it's sort of a slippery slope beyond that initial purpose.
Yeah, because there are going to be a lot of people who make a lot of money by having an even more precise way to track our movements, advertisers, other private companies. But then on top of that, surveillance vendors will be able to easily use that data for other purposes. So, for example, there was great reporting on how ICE, Immigration and Customs Enforcement, uses a vendor called Palantir and a few other Silicon Valley firms to monitor the movements of undocumented Americans to figure out, the perfect time to target them and their families, and then to increase the efficiency of their deportation efforts. We could see that very same approach using the sort of Bluetooth beacon data that we're talking about here.
Chris, what else you got?
Great. Here's one from Christopher H., who is watching from Australia. It's probably around 4 in the morning where he is. But he was curious about adoption rates. Do you have a sense of what adoption rates need to be in order for this to be effective?
I've seen a number of people talking about 60% adoption rates as being necessary. I think part of it tends to be also you're trying to reduce a bunch of different like housing patterns, working patterns into a single number. And so likely the adoption rate necessary for, critical mass and efficacy would be different if you're in a big city and potentially exposed to, 100, 200 people a day versus in a remote area where the number of people you interact with on a daily basis is much lower. All of these different factors are likely going to play into what is a critical mass to have at least some marginal benefit in fighting COVID-19.
Got it. And I will ask one more before I turn it back over to you, Brian. There's been some doubts cast on Bluetooth technology, and you've discussed some non-technology solutions. But do you have any thoughts on alternative technological solutions that might work better than Bluetooth, something that's out there today that people are missing for some reason?
I wish I did. I can tell you, I so wish there was a technology I could pull off the shelf behind me that would help us get back to life as normal and help keep our families safe. But the problem is that every time I look into these tools, it's pretty clear how they can be abused. It's pretty clear what the potential harms are, but it's really tenuous whether they'll be any help in supporting public health and preventing the spread of COVID-19. So sadly, I haven't seen anything so far.
Thank you.
Albert, when we were speaking the other day, you mentioned the idea that this instinct to lean on a technological magic solution falls into the category of what I think it was the tech critic Evgeny Morozov called tech solutionism, where the idea is that you name a civic or political or legal problem and a technological solution is invariably dreamed up for it, but turns out to be an imperfect fit. It doesn't quite, it can't quite carry the weight of all that would be expected. Why would this be an example of solutionism, and why do you think we're so vulnerable to that problem?
Because I think it's so hard to make the investment in public health that it takes to use traditional responses to COVID-19. I think we're really scared right now. And so anything that comes in as a magic bullet seems like we're willing to take the risk. It almost is like when President Trump said a few days ago, "What do you have to lose?" And I keep hearing that same mindset, albeit phrased slightly differently, from people who say, well, yes, this may be deeply invasive, it may be corrosive to our culture, it may be antithetical to democracy, but what do we have to lose if it can get us a bit closer to a cure? And what I always point to is, a not so distant example of the same mindset, where when faced with the reality that millions of Americans lacked access to routine medical testing and primary care physicians, Silicon Valley gave us Theranos as the answer. They said, we'll reduce the price of testing and that will solve everything. But it turns out, it was just smoke and mirrors in the end. I'm worried the same will be true with many of the technologies we see being rolled out today.
Well, a similar argument you sometimes hear is, what do you have to hide? If you have nothing to hide, you shouldn't mind using a privacy incursion technology. What's your usual response to that?
Well, I think it's so contextual, right? I think that for each of us, there's a different answer, but for each of us, there's some part of our life that would make us profoundly uncomfortable to give away the ability to control it. For a progressive audience, it might be, I might highlight the difficulty protesting if you have the ability to track everyone's location at any given time. For a conservative audience, I might point out that this could be an easy way to track everyone who goes to a gun show and try to figure out who purchases a gun. For For different audiences, it means different things. But I think for all of us, when we really look ourselves in the mirror and think about it, there's something profoundly upsetting about someone we distrust, potentially having a window into the most intimate aspects of our life.
All right, well, let's end on that note. Albert, thank you very much for being here. Thanks to everybody who was viewing today for this Globe Op Talk. These Op Talks are an experiment, and we'd love your feedback. However you'd like to send it. letter@globe.com is one way. But we also welcome you to visit Globe Opinion and to read Albert and Evan Selinger's perspective from earlier this month on protecting our privacy and civil liberties requires more assurances than Silicon Valley can provide. And we also invite you to join us for future Op Talks. The next one is on Thursday. I'm really looking forward to this one, wherein Beena Venkatraman, who heads the opinion section at the Globe, will be talking with psychologist Guy Winch about whether flattening the curve is crushing our mental health. So thanks, everyone.
Thank you.